Richard, I'll go back to you now. No doubt we spoke about that kind of lull, but they're still ongoing. Tell me a little bit more. What's happening in the CMET world?
So CMET, or the hepatocyte, the hepatocyte growth factor receptor, is felt to play an important role in liver regeneration, in normal liver biology, and as a receptor tyrosine kinase, like EGFR, like HER2, like FGFR, is implicated as being an oncogene. CMET inhibitors have been around for a while, both kinase inhibitors and antibodies. They've been pursued in gastric cancer and lung cancer first, and have failed. However, the story in liver cancer is still ongoing, and it's an exciting area. Largely because if you look at how the other drugs were developed, the CMET inhibitor, at least tivantinib, has been developed initially based in the second-line setting on a randomized phase 2 study, which was generally negative, tivantinib versus placebo. But retrospectively, they went back and saw that patients who had elevated CMET expression by immunohistochemistry actually had an improvement in OS. It was a small number. They found that patients who had high CMET expression actually had a worse prognosis, and there was data presented at the GI ASCO meeting also supporting that. There's been the idea that CMET expression or upregulation of CMET plays a role in sorafenib resistance, and therefore a very large randomized phase 3 study has been completed, and the results are awaited. That is now taking tissue at a biopsy and enrolling patients that only have elevated CMET expression and then randomizing them to tivantinib or placebo. The results are awaited. This is a very important study because it would be the first biomarker, predictive marker therapy in liver cancer should the study be positive.
Well, I have to say that, here I'm not taking a bet, but it's fascinating. No doubt we agree that there is a prognostic value probably for CMET, which needs still to be deciphered in part of phase 3 trials. But this is what tivantinib actually has been only offered for patients with more than 50%, 3 to 4 plus CMET expression, while the other study, cabozantinib, we took a different approach where pretty much we're treating everybody because of the multi-kinase component of the drug. Time will tell, but obviously these are very two valuable studies that really are ongoing. Other things ongoing, I might recite ADI-APEC-20, which is arginine deamination and depriving the cells of arginine. There is regorafenib, which is pretty much a multi-kinase as well, with a great study still ongoing in the second-line setting. But I would like to really finish up by talking about what we all talk about, the elephant in the room, immunotherapy. So.